Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's podcast. We're going to be talking about virtual primary care in women's health, brought to you by One Touch Telehealth. And I've got two great guests for us today, two amazing physicians in their field. First, I have Dr. Sina Haeri, who's a board-certified maternal-fetal medicine and OBGYN, who's also served as a surgeon in the U.S. Army. He's working currently with the Access Physicians. Dr. Haeri is a maternal fetal medicine specialist and educator with the Texas Children's Hospital and Baylor College of Medicine. And we also have Dr. Annelise Swigert. She's board certified as well, OBGYN, who's been in private practice in Minnesota for almost 20 years. Her passions are really in OBGYN, delivering babies, and collaborating midwife practice into her group. She's a leader both locally and nationally in women's health initiatives and is currently the CEO of Premier OBGYN of Minnesota and a consortium of over 50 OBGYN providers. Welcome to the show, both of you. Thanks so much for joining us.
Thank you for having us. Thank you.
Well, awesome. Today we're going to be talking about all things kind of women's health, and I want to set the stage. There's been a lot of talks of how women's health has really changed. As in women's health, we're always usually looking out more for kids' appointments and husbands' appointments and making appointments. And a lot of times our healthcare comes last. And so really want to talk about what you guys are seeing. You're on the front lines and seeing if that's really changed, as well as you've got more working women in the workforce, which convenience is now very important. And you've got a lot of millennial moms in the mix that have different communication preferences. So I want to start off by asking both of you, have you seen a change in the last few years on different than either different generations or more convenience, or what are you seeing that may be different than if you had this conversation 5 years ago? I'll start with you, Dr. Sina.
I think one of the more important factors that we're noticing in today's generation of women that are going through a pregnancy, which is the population I deal with predominantly, is that they are definitely more tech savvy. They are less loyal to the OB that may have taken care of their mother or their family and so forth. And they do look for the better patient experience, the more easier access per se. And that's probably the most notable thing. The second part that's actually helped us is that empowerment. A lot of these women come into the office having done their research online. A lot of times they know the disease process much better than the couple of generations before, and it makes the counseling go a little bit easier.
And what do you think, Dr. Swigert?
I certainly would echo that. We are seeing that the younger generation, which I also deal with in terms of pregnancy, but also just routine well women visits, contraceptive care, their expectation is that medicine should be keeping up with the rest of the world in terms of the technology. And they expect to be able to have access to us other than just seeing us in the office the old-fashioned way, from both a time management standpoint, an expense standpoint, lost work hours standpoint. They have other options for care, and they may not necessarily be, as was mentioned, beholden to that doctor they've always seen, but they're going to find the doctor that's more convenient for them, that's going to offer them what they're looking for as a consumer. And so I also tell some of my physicians, we have to understand that our patients are also our clients and our partners in terms of information and shared decision-making.
No, that's great. And that kind of goes to my next question is, Dr. Swigert, you work a lot of women's health initiatives and really empowering, keeping your practice kind of private. And, there's been a lot of mergers and acquisitions from a health system perspective. What are some things that you think are critical for that local OBGYN to really stay local and deepen those local relationships to meet kind of today's patient and have better patient outcomes. What are your, advice to other folks that have private practice of what they should kind of be doing in their local markets? To speak to a partnership that we have, it's really important that physicians understand they have to be innovative and they have to be strategic. And just because they've done something for 25 or 30 years or even 10 years doesn't mean that they can continue to do things that way and remain relevant. And in a small private practice, that often means understanding that you have to find new ways to get patients through the door. For us, it's been things such as an app that we use called Doc ASAP, where a patient can go online, a new patient, she can make an immediate appointment, she can make a same-day appointment and have immediate access to us. And I think the second piece of that, this telehealth piece, obviously that's a focus of this discussion, but that can be more difficult for smaller groups to incorporate into their practice from the standpoint of working through contracting with payers. How do we incorporate that into our daily schedules and into our time? But if we're not innovative and if we're not strategic, then we will not have a place at the table. And even with regards to telehealth, there's small independent companies that will hire doctors elsewhere. And if a patient can get on with them at 7 o'clock at night, they're not going to wait to see us the next day. So we really have to work hard to stay relevant. Yeah, it's interesting coming out of a Gen Z podcast. That's one of the big things is, it's instantaneous. It's now or never. And Dr. Sina, you've been doing telehealth for quite some time and virtual care in women's health. Tell us a little bit about why you think it's so critical and what you're doing and the overall care and work-life balance too, that a lot of times we don't talk about for the physician. And your kind of journey in that regard.
Absolutely. Let me touch on the Access Physicians platform, because that is basically, I think, where we have the biggest impact on the communities. We thrive in the rural markets and where access is limited. And essentially for us, the most vexing problem that we face right now is maternal mortality numbers. That's getting a lot of attention, maternal morbidity numbers. And it's hard to ask a mother who's living in a rural area to fire up her diesel engine and drive for 2 to 3 hours to see a subspecialist. Right. And similarly, it's hard to ask an MFM who there isn't that many of us around to begin with to, expend that windshield time to drive out to these smaller communities to see 4 or 5 patients because it's not financially feasible. So what we've been able to do is we've been able to stay agnostic, which is, I think, fundamentally a very important point for a subspecialist. So we're not tied to a health system. So the referring OB doesn't have to necessarily worry about me coming into their community and stealing patients and taking it back to the big city. Secondly, we bring finances to the table and show the C-suite at these hospitals in rural America that, listen, there is a way to have a subspecialty support in your hospital and not get killed. And we can, in fact, help you incentivize that and keep your hospital afloat, especially labor and delivery, because those are the units that are getting killed off faster than anything else these days. Right. And we've got the art down to the point right now where we deploy a tele-MFM program in a rural community. We can cut down moms traveling out of that community to see a subspecialist to about 3%. And those are usually the surgical babies or the moms that have really complex issues that need to be in a bigger city. And on the inpatient front, we've been able to cut down the number of unnecessary transports out of the mother's community, social support network, and everything else by 30 to 40%. And I think improving that access to care inherently is going to bring down the mortality, morbidity numbers. And that's where you have it. With respect to work-life balance, it was a fundamental change. And actually, the funny part is when you work in telemedicine, inherently, you don't make as much as you do in the office because a lot of times you're giving up procedures, and those are the big cash cows for a lot of folks. But I have had no problem recruiting. Recruiting for us has been easy because you do get the luxury, especially if you have young kiddos, to be at home, to provide good medicine, but at the same time, be able to drop the kids off, pick them up from school, and have that flexibility and, not be tied down to the office.
Not get the burnout that a lot of folks are feeling from that perspective.
Exactly. And in fact, what we do a lot of times is we do back up local solo practitioners that are getting burned out. We come in and cover them nights and weekends to give them a little better quality of life.
No, that's great. And the next thing I want to talk about is with the millennial generation, there's been a lot of statistics and a lot of proven data that a primary care physician just isn't as important to them. They don't have a primary care physician. Maybe they walk into a clinic or they use telehealth or whatever it may be. Do you think that changes the OBGYN kind of relationship, especially in women's health, if they're not doing normal kind of primary care? And I'll take it to you, Dr. Swigert. Are you seeing more like just general questions you're getting that you're kind of now having this kind of extended primary care relationship because that is kind of a deeper relationship that you have with a woman? Or is that changed for you, or is that still kind of the same?
Well, I think because I'm still in a suburban metro area, and because my practice has a well-known reputation in the area, I still have patients who have started with me as teenagers. I will deliver their babies. I will take care of them after menopause. I still see patients that I actually delivered. I'm starting to see that now. I've seen a couple teens that I delivered 15 years ago. And I think there's a benefit to that relationship. And a lot of it, you know, more than medical knowledge on our front, it's the trust relationship. It's having confidence in a provider. And when women's health issues that can become so sensitive, no matter what age they are, feeling like you trust someone enough to talk those through. So we're still seeing that relationship there. You know, that said, I may see someone only once and I can still have an open and trusting relationship with them. And again, that is going to change with this younger generation who may decide that, you know, they don't need an OBGYN until they're actually pregnant. Or they may decide they're not going to spend healthcare dollars or their own dollars on healthcare with a high deductible plan just to get a pap smear. If they can go to Planned Parenthood and they can get that pap smear for less. So they are savvy about how to utilize the healthcare system. And I do think for that generation, probably the relationship with the physician is not going to be the most important piece. It's going to be cost and it's going to be ease of access.
Yep. And so I want to get your guys' opinions. You know, you can't turn on the radio, a podcast, TV, anything without hearing all these women's and men's too companies popping up where you don't need to go into a doctor to get your birth control, or you don't need to go into a doctor to get your hormones, or, you know, all these kind of things. And I think there's, you know, physicians have both sides of the fence of this. As it's one thing to do it with your local physician, but does it then take out kind of the history and the full medical care to do things like this? What are your guys' thoughts? I'd love to hear your opinions on all these new companies that are obviously thriving to be spending the marketing dollars that they are. So Dr. Sina, we'll start with you.
You touched on it. It's a critical problem. I think there's two subset of companies. There are the ones that do, for instance, hormone replacement or more of a concierge focused on one modality that they address. And then there's the sniffles medicine. There's the virtual urgent care that a lot of the younger generation is utilizing. And because of the fact that they're so accessible, they're not as amped about going for preventative visits and the annuals and so forth. I think the totality of this is that it's a disservice to the patient because, for instance, we know how to manage, you know, some hormonal issues or birth control pills and so forth. When you go in for that visit, it's very unlikely that either one of us is going to sit there and just focus on that. When you come into the office, we're going to look at the total picture, do the full medical assessment. And sometimes you do find little things that the patient may have brushed off in the review of systems that might have to be addressed. And I think as such, they have their place and they are successful, but I do think there has to be set limits on when it's used and really having the patient education behind it that, listen, just because you're doing this doesn't take away from the fact that you should be getting your annual exams and preventative visits and so forth.
And Dr. Swigert, on your side?
Well, I would agree with all of that. And one of the things I've seen is frequently these sites, and certainly that virtual urgent care, they are not staffed by physicians. These are mid-level providers, physician assistants, and nurse practitioners. And they do have a role. They have a role for using very straightforward, simple clinical algorithms, but things are going to be missed and there are going to be complications and there are going to be sick patients. And so I think it's really making sure that patients understand the limitations of these services. I've seen many patients in my clinic come in who got inappropriate medication, the wrong diagnosis. I mean, this is meant for really straightforward, easy things, but also to the point that if they're not asking the correct questions, for example, if you are giving a 16-year-old estrogen-based birth control and you haven't asked about a family history of blood clot, and she ends up with a pulmonary embolus 2 weeks later. I mean, these are serious consequences that can arise from not having the full complete picture of healthcare. So it's a matter of using those services appropriately. I will also mention, in addition to those companies, many large employers in our community, Target is one of them, are now putting these mid-level providers into the offices.
Yeah.
And it's to decrease on lost, work hours, obviously, for that company. So now they'll say to a patient, well, you don't need to get your birth control refilled with your doctor. Our nurse practitioner will refill it for you downstairs. And then they're, from a cost perspective for the employer, they're cutting that out. And then the patient feels pressured to do that, even if they'd rather see me in the office. And so it's just making sure that that new generation understands the limitations of these options.
And can I touch on this for a second?
Sure.
I think the onus is on the vendor. For instance, we have a direct-to-consumer platform called Prenatal that does direct-to-consumer MFM consultation for folks that just need a second opinion or want direct access. And one of the points that we make sure we drill in the patient's head is the fact that, listen, our service is there to make your life easier, but this does not in any way take away from your relationship with your OBGYN who's taking care of the totality of your care. So you do have to understand, at the end of the day, that's the person that needs to be in lockstep with you for your care, and we're not replacing that. And I think the onus should be on these vendors to really educate the patients about that. Make your money, that's fine, but also let the patient know, you know what, we're not addressing everything.
Yeah, and I think those are all great points. I think we're going to see a progression. We've talked a lot on the show about, our 10 years from now, are we going to be saying, for millennials, we have no patient history because they went to urgent care A, B, D, and, there was never, a colonoscopy, or there was never a full picture of a patient. But I think a lot too, if you, talk to different generations, if they had a choice of, if it was 10 o'clock at night, to talk to their OBGYN through telehealth or talk to a random one, they're going to go with the one they know. But if it's not offered, then they go with that. And same with primary care, same with all of it from that standpoint. So I think as more practices kind of, to your point, Dr. Swigert, earlier, kind of innovate and strategize, whether it's obtaining new patients or retaining the ones you have, you'll have better patient outcomes, more billable, better, revenue from that perspective of things you're already doing today. And so the last thing that I want to ask is, depending upon the physician, there's certain things that just require a physical exam. There's certain things that can be done virtually. And as we're talking about virtual primary care and women's health, I'd like, to go around and say, what are a couple of things that you think are good in women's health that can be done virtually that may be in between? So it may be an office visit, a virtual care, an office visit, not all virtual care. What are things that are good for virtual care, and what are things that obviously delivery of baby, physical exam, things that are no-brainers, but what are things in what you guys are doing that would be good for virtual care, both from your standpoint, if we have time to do better work-life balance, as well as the patient side? Dr. Sina, we'll start with you.
So I can speak at least to the maternal-fetal medicine side of it, because we are predominantly a cognitive specialty, and because we have the luxury of good OBGYNs being downstream from us and being the hands on the patient, we are able to do chronic disease management and pregnancy virtually. Ultrasound interpretation is another one. What we do is we go in and we train up the sonographer so that the local assets can scan, and we come from behind and use our expertise. And to give you an example, we have data now from multiple rural facilities where we took regular sonographers that were doing OBGYN scans, and we came in, and through our training program and our reads from an MFM perspective, we actually picked up about 7% abnormalities that otherwise were marked normal by an OB sonographer. That's one of them. And from an access physician standpoint, just to show you how much we can do through telemedicine, we are the code blue team for 50 hospitals in the US, where we train the local staff, whether it be RT, nursing, and the physicians, and we stand at the foot of the bed and dictate the CPR and the code algorithm and so forth. And I think that's as critical as it gets. And if we're able to do that through telemedicine, then I think there's ways to innovate and deliver a lot more care to these underserved communities and get them what they need.
Yeah, and we see that a ton in rural health of, just lack in specialty in general. Mm-hmm. And Dr. Swigert, on your side?
Well, I would say a few things that we do just in the general OB/GYN practice that even though we're in a metro area could be delivered just as good, if not better, through telehealth. One is contraceptive counseling. Certainly we spend a lot of time discussing with teens and actually women of all ages what their options are for birth control. Some birth control choices will require a visit, an IUD insertion, but an Nexplanon insertion. But we can cut down on the number of visits they have to do in the office by doing that counseling in a telehealth visit or virtually. We can certainly prescribe contraceptives that way. We can do follow-up that way. I think another really big one that we see is mental health. There is no question that mental health for women is a huge issue right now, very specifically postpartum. Women who have a new baby do not have necessarily time to come into the office. They can't get childcare. In our part of the world, weather can be an issue. Certainly from a rural standpoint, access to mental health resources is huge. You can sit down and do a full assessment for a woman for postpartum depression or anxiety, or women of any age for postpartum depression and anxiety without doing a physical exam. And those sometimes are the women that are most fearful of taking that initial step, making the appointment, coming into the office. So we are going to actually use postpartum mood disorders as a platform for us to start initiating telehealth, because we can do follow-up with those patients. So I think that's a huge area where virtual medicine is going to be very important.
Yeah, that's great. I mean, we talk a lot about mental health on the show, so I appreciate you bringing that up on the postpartum side. And also, there's a lot of great companies out there that are, really creating flags, whether it's in pain management, whether it's women's health like that. That's, even if you're taking a survey when you come into a physical office, to just say, hey, you should, as a physician, you should talk to them about mental health, because they've answered the associated questions that flags them. And even being able to, connect them to kind of talk to somebody, and whether it's a peer support group or a therapist or whatever, because as we know, mental health has the highest no-show rate across any industry, because it's so hard to go to appointment 1-2 times a week. And so we really got to start thinking outside of the box about more access there and more convenient. If you're in the program and you're, doing those appointments, it's a lot easier than when you fall off of any routine. So the one thing we ask at the end of every show is, what is one thing healthcare that is keeping you up at night? And we take out husbands, wives, kids, all the things that give us headaches. But what is one thing that's keeping you guys up at night? We'll start with you, Dr. Sina.
Parity law. I'm in telehealth, and parity law is the bane of my existence. I just hope that something happens nationally and it basically evens the playing field, but that's what it is. And, and I sometimes joke about it, and she can relate to this. Sometimes I think people forget that we actually can deliver better care virtually than we do in person. A prime example is an amniotic fluid embolism, which is as catastrophic as it gets on labor and delivery. If you have a subspecialist that comes and visits the patient there, they may come back and see the patient a couple of times in the ICU and so forth. With telehealth, we're able to beam in literally every hour and check on that patient throughout the next 24-hour period and so forth. We just need time to get that parity law caught up so that the insurers can realize the value telemedicine brings to these patients.
Totally agree. Dr. Swigert?
Well, the one thing that keeps me up at night is, of course, delivering babies, because that's what I do in the middle of the night. So that'll always be number one. But I would say access, to repeat a word that we've discussed throughout this podcast. And when I saw that question, that's literally the first thing that popped into my mind. Whether it is access because in parts of my state, women can't get to an OB/GYN, whether it's access because women don't have insurance, whether it's access because they are afraid to talk to a provider about mental health issues or contraception or options. I mean, I go into private schools to kids who I know have health insurance and talk about ways they can access contraception so their parents won't get the bill. So access has a lot of different faces, but truly women of all ages and in all socioeconomic backgrounds deserve access to care, absolutely.
Totally agree. Well, I want to thank you both so much for being on the show. As always, click in the show notes, follow either guest today, and they're both doing amazing things. Make sure you follow the journey and what they're up to. Subscribe to the show, get your new shows delivered to you every Tuesday, and now Thursday, the Knowledge Nugget edition. And we look forward to having you on future shows. And we will see you guys next week.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.